It is one of the most common reasons that people go to their primary care provider. So when people have distress in their life, the distress often, if it's emotional distress, comes out in a physical way. So the majority of people who struggle with anxiety, when they go to their primary care doctor, they don't come in saying, I'm anxious. The minority come in saying, I'm anxious. The majority come in with physical complaints. Most commonly, they will complain about fatigue, low energy, sleep disturbance is very common, pain. These are ways in which people will manifest their anxiety, similar to if they struggle with depression as well. There's general anxiety, social anxiety, post-traumatic stress disorder, which people associate presenting like an anxiety disorder, panic disorder. There's easy ways to diagnose those things, but only if you ask the questions. There are medications that are very effective for anxiety. There are great therapies, for example, cognitive behavior therapy, very effective for anxiety. And the general things that all of us get told all the time: good sleep, regular exercise, trying to modify as many of the stressors as you can, understanding life happens and sometimes you can't control some of the stressors in your life, but all of those things can help with someone with anxiety. It's very common for people to not believe that what they're experiencing is anxiety. If you go to any emergency room across the country, there will be people who come in every day having panic attacks that are convinced that they're having a heart attack. So my response is always, well, thank goodness you're not having a heart attack. Isn't that awesome news? The good thing is you have an anxiety disorder, and guess what? It's treatable. There's huge stressors in the world these days, and I think if you look 150 years ago, who was in your community? You probably had relatives, blood relatives that were in your community, friends, people that you had grown up with, you knew your whole life. Those were the people that you were around. That was your community. How many people now actually can say that they have family members that live in the same city that they live in, let alone the people that they grew up with, that they're familiar with, that they know? So I think there's been a softening of people's communities. There's a loss of community for many people, which is community. It can be very comforting for folks, and unpredictability is one of the things that drives anxiety for many people. Kids are on social media a ton. They get exposed to it a ton. The bullying that can happen. When you're at school and a kid, how many people do you actually really get a chance to talk to in a day? 10, 15 maybe? When you're on social media, you could be exposed to 200 or 300 people in one day. It's just a very different scale now. So I think that's part of why younger folks are struggling with anxiety issues. What I think everyone should do is identify what helps them manage stress. Some people say, if you tell me to go be mindful and meditate one more time or take a yoga class, I'm gonna barf, right? That is not their thing. For some people, it's listening to music. For other people, it's fly fishing. For other people, it's taking a walk. For other people, it's going dancing. Other people, it's mindfulness, meditation, yoga. It's a fill in the blank, whatever fits for you. I can't tell someone what they should do to help reduce their stress. I need to get to know them, find out what things stress them, and also what things reduce their stress and increase their resilience. So it depends on the person what they should be doing.